New at 5, parents, you may soon be able to protect your children from the dangerous respiratory virus that is leading cause of hospitalizations for infants. The FDA is reviewing Pfizer's RSV vaccine on an expedited basis. And as Eyewitness News reporter Christian Cordero tells us, a decision is expected by August.
Today, some of the most vulnerable people at risk of dying from RSV are one step closer to getting protected from it before they're even born. Pfizer says the FDA has accepted its application for review on this first-of-its-kind vaccine, which is given to people during pregnancy to pass on to their infant. Dr. Rishma Chand explains how it is an exciting new vaccine, but far from a new concept.
This is something called passive immunity. It's very common during pregnancy. Mothers who get infections during pregnancy end up passing those antibodies to their unborn child and to their child when they're breastfeeding.
Pfizer says the vaccine was 81% effective at preventing severe illness in children under 3 months old, 69% effective within 6 months of life. RSV was one of the 3 viruses to make up last fall's triple-demic. Dr. Chan says it is a common virus, but became less common during COVID and therefore more dangerous once we emerged from COVID restrictions. Infants are especially at risk, in part because their airways are smaller, and this is a virus that attacks the respiratory system. According to the CDC, between 58 and 80,000 children under 5 are hospitalized from RSV each year.
Sometimes it's just oxygen. I say just oxygen, or it could be something, as severe as mechanical ventilation and requiring a pediatric ICU stay.
Amanda Bentley's 18-month-old son Joshua was one of those babies hospitalized at Providence Cedars-Sinai Tarzana Medical Center when his oxygen levels dropped dangerously low. She spoke with us in October.
He stopped talking, he wasn't eating or drinking.
Joshua has since recovered. Hundreds of young children, according to the CDC, don't. And Dr. Chan says even the journey for those who do can be traumatizing.
It's devastating for the child, for the parents. And if there is a vaccine or something that's going to help these little, young, vulnerable children in the future, I'm all for it, and I'm very excited.
Several companies are working on RSV vaccines for older adults. The FDA could decide whether to approve Pfizer or GSK's vaccines for that demographic in the next few months. I'm Christian Cordero, ABC 7 Eyewitness News.